Hi, I'm Jason, student PTA. I'm here to go over some shoulder exercises for a left shoulder adhesion. I've already washed my hands, so I'm going to take it a step further because of all the coronavirus going on, and I'm going to sanitize my hands with just some regular hand sanitizer. The treatment patient today is my stepson Mason. I have permission from him to do treatment and be able to show his face and everything. He's given me that permission. So I will go get him now and get ready for the treatment. Hi Mason.
Hi.
Jason.
Nice to meet you.
How you doing today?
Pretty good.
Go ahead and have a seat here in the treatment room. So what brings you in today?
My left shoulder is hurting.
Left shoulder.
Yeah.
Go ahead and pull the chair up here so I'm not standing over top of you. Left shoulder. Whereabouts on your left shoulder? Any particular area?
No, not really. It's just all through it. It gives me pain.
Okay. What would you rate your pain?
About a 7.
7. Is that constant?
Yeah. When I move it, it's a little more.
More movement. You take anything for it? Does it ease up any at night?
No.
No, so you kind of ache all the time.
Mm-hmm.
Do you have any concerns with your daily routine of stuff you're not able to do or difficult doing? Comb your hair, brush your teeth.
It's difficult to just lift it, move it around. So probably just basic stuff. It's annoying to do because it's hurting.
Just general ADLs.
Yeah.
So you got high blood pressure. Any changes to your blood pressure medicine or any issues with your blood pressure?
No.
Did you take it before coming in today?
Yeah.
What were your numbers?
80. What's good?
120 over 80 is
120 over
good.
80.
So,
80.
that's good. That's right where you need to be. Okay. A few things we're going to do today is I'm going to do some checking on your shoulder, and we're going to do an ultrasound on it to kind of try to relieve some of the pain and loosen it up a little bit in there. And then we'll go through some modalities for your scap and shoulder, do some stretching, strengthening, and give you a home exercise program to take home. That way you can do it later. All kinds of fun stuff for you. You can go ahead and just stay there. I'll ask you a few questions. Have you had any fractures or anything like that in your shoulder?
No.
No. Look here. Not red anywhere, so it doesn't look appear to have any inflammation. Let's see, we got good circulation. Capillary refill. Can you feel my fingers? Are they hot, cold?
About in the middle.
Just normal?
Normal, yeah.
Okay. Have you ever had any joint replacement or anything? Any shoulder surgery?
No.
No. Any tumors?
No.
All right. Well, that's good for all that. Let's go ahead and get started on the treatment. Now, normally I would do an ultrasound here, but since we're at home and I don't have the ability to do an ultrasound at home, I'll just go through the scenario of it. We're going to use a 5 centimeter head, which will take up a pretty good area of the shoulder here. We're going to use the gel as the median, that way it doesn't get too hot on him. We're going to do a continuous deep heat at 1 millihertz 100% duty cycle with power setting oscill at 1 watt centimere squared. When you do this, you want to stay in an area no more than 2 inches bigger than the transducer head. That way you get a good impact of where you're doing it. Treatment, you usually want to do at least 5 for it to be beneficial. But for billing purposes, you got to do at least 8 minutes. So that's what we'll do today, is an 8-minute treatment, and see how it affects him after that, and make sure there's no redness, soreness, anything like that after the treatment. That would be normal, but since we can't do that, we'll just move on. So, go ahead and have you climb up here on the table, my lovely plinth. Head up there on that end. First thing I'm going to have you roll, face me over here. Do you need a pillow between your legs, or are you okay?
No, I'm alright.
You alright? Have you slide over towards me some. With most shoulders, you're really tight in your scap with trying to move anything. You don't have much movement, which will hinder how high you can raise your shoulder. So what I'm going to do is I'm going to do some mobilization of your scap back here. So the first thing you want to do is you want to get your fingers up underneath the scap border and kind of pull. Try to get that shoulder blade moving. You move way too easy. You want to do this at least 10 times, really get a good stretch in there. You don't want to overdo it too much and pull anything. You just want to kind of go with the flow of the scap. Kind of out and pull up. Trying to get that good normal movement there. Does that feel any pain or anything with that?
A little, not a ton.
Okay. If you do have any pain or anything throughout, you let me know what's hurting so we can alter treatment or stop or however. Next thing we're going to do is I'm going to have you lay on your back. I'm going to do a glenohumeral joint mob. I'm going to do a posterior glide on that. Arm out to the side. All I'm doing here is I'm going to just have you rest your arm on my hand, and I'm going to take here and I'm going to push down and just try to open that capsule up. I'm going to do this probably 10 times, depending on pain. Any pain or anything with that?
Yeah.
Bad pain, or
No,
just discomfort from doing it?
Yeah, feels like it's stretching.
I can tell you're pretty tight through here, so I can add that to your home exercise program. A good stretch for you. Again, you want to do this probably at least 5 to 10 times, depending on how tight it feels. Which you got pretty good tightness, so you probably want to do at least 10. Okay. Alright, next thing we're going to do is we're going to do some stretching. All these you want to do, well actually I'm going to do a levator scapula stretch for you. Because it says you got your forward head and everything, some tight muscles. I'm going to go ahead and take the pillow out from underneath you. Go ahead and lay your head down. Your levator scapula runs right through here. So what I'm going to do is kind of have you like looking towards your armpit over here. I'm going to push down here. You feel that?
Mm-hmm.
Is it bad?
No.
Pretty good stretch?
Yeah.
You want to do this 3 times, hold for 10-15 seconds. No discomfort or anything?
Mm-mm.
we're going to do the stretching. A couple of first ones I want you to do is, it's called a chin tuck. Basically gives you what I have already, a double chin. You're just going to pull your head back, and you want to do that 10 times, which for the purpose of the video we're just going to do 5. Okay, how's that feel? Different?
Yeah.
The next one, you want to take like the back of your head and push it down into the pillow. We're going to do that. Just hold, push down and hold for about 5 seconds. We're going to do 5 of those as well. Okay. Got that neck good and loosened up there. Now I'm going to do some stretching on the shoulder here. Oh, about right there, about how far you can go. So what we're going to do is I'm going to push just a little bit past that, and you let me know if that hurts too much.
Okay.
That hurting?
A little bit.
A lot?
Yeah, it feels like it's pushing it.
Okay. We're going to try to do these at least 5 times, 10 if we can. Does it start to ease up a little bit? Or they're still pretty intense?
Yeah, it still feels like it's at its max.
Feeling a little bit better?
Yeah, it's loosened a little bit, I guess.
That's good. Alright, next one we're going to come is out to the side. Bring you out this way. Right there, about how far you're going to get. And how's that feel? Is that pretty intense?
Yeah.
It's not too much, is it?
No.
A little pop in there, that might have been good. Might ease that up a little bit.
Hi.
Hi. It seems like you're able to go a little bit further, which is what we want. Okay. Now, a lot of times we'll put a towel under here. I like to use my hand for it. I know you can only go up so far instead of going up to 90, so this one we're going to take your hand backwards and see what kind of stretching we have there. Yeah, you are tight. How's that?
It's fine.
Any good pain or bad pain or?
Yeah, it feels like it's stretching, but it's not bad.
It seems to be loosening up overall.
Mm-hmm.
Okay, I'll go down towards the front. Definitely got more that way. Any pain with that?
No.
exercises. Okay, how you feeling?
A little sore from it, but
A little sore.
looser.
Okay, well we're about halfway through, so I'm going to go ahead and check your blood pressure, make sure, since you've been laying down, how everything's doing. You've been doing a little stretching and everything. He wants to help be your therapist. Good job, Boogie. So go ahead and check it real quick. Looks like you're running right at the same. 120/80. I'll check it again at the end of treatment. Make sure you're still staying on target where you need to be. Okay, next we're going to do is some exercises. We've already done a couple of them with the chin tucks and the head press, since we stretch out your scap and your levator scapula and everything. So we'll go ahead and have you sit up. I'm going to put this towel underneath you. Okay, go ahead and lay back on that. That'll give you that good overall stretch, because I notice your shoulders are a little bit forward as well. I want to try to get them pulled down, because you're tight here, weak here. So what we're going to do, this will help stretch these as well, being on the towel. Plus the exercise we're going to do is going to stretch and strengthen your back. First one we're going to do is we're going to do an overhead flexion with this nifty little bar here. So go ahead and put your hands on there. And since this hand is the one that's limited on how far you can go back, let this one control how far you go, but let that one try to let you go a little further each time. Let's go ahead and press it up. And you're going to go back over top of the head. Just let it try to. Now you won't be able to go all the way because of your limitation and pain. We're just going to do 5 sets of those. So just come back to center and then back down. Any pain with that?
Yeah, I felt like it was pulling a lot.
Pretty good.
Yeah.
Okay. Next one we're going to try, which I think you can do. It's called a butterfly. You'll just put your hands behind your head. And I know this one, it only goes up so far. I mean, if that's all far you can get it, it's fine. But maybe with the ease of doing it, you might be able to get up further. So just have your hands back here and just do just like you're doing a butterfly. You're going to do 5 sets of those. And try when you come down to try to stretch that scapula back here. Any pain with those? Difficulty?
No, that wasn't bad.
No? Okay. Next one I personally like, it's called a bear hug. So what you want to do is you want to kind of cross and try to really stretch that back out, and then when you come back, try to really squeeze in the back. We'll do 5 of those as well. Pain or anything?
Just when I reach around like this.
No.
More towards the back or more probably in there?
Just up around.
Okay. Nothing too bad, right? That's good. That's what we want. Feel okay?
Mm-hmm.
No shortness of breath or anything like that? Okay, we'll go ahead and have you sit up again. Put this towel up underneath you. Okay, go ahead and lay back down. We're going to have you roll facing that way. Put this towel up underneath here. What you're going to do is you're just going to no weight, just as far as you can bring it up, which is about right there is all you're going to get. Just, I'm going to do that 5 times. Just make sure you keep your elbow against the towel. Good? Alright, we'll go ahead and have you hop up off of there. What we're going to do is I'll show you, we're going to do some flexion, abduction, and extension exercises. Just lean over like this. You're going to just go up as far as you can. And you're going to come out as far as you can. And then towards the back as far as you can. We're going to do 5 sets each of those. Just make sure just to rest on the table to come up towards. Yep. How's that weight? Is that okay?
Yeah, that's fine.
Not too much. Just do the front first. Just do all 5 of those. Try to keep that arm as straight as possible. And when you do these out to the side, turn your hand. There you go. Now out. Any pain?
Not bad.
Is that weight okay? Not too heavy or too light?
No, that's fine.
Feeling now? Feel okay?
Yeah.
Not too awful bad?
No.
Okay, grab this with your left hand. What you're going to do is you're going to grab the towel real quick. This up with your arm. What you're going to do is you're just going to pull inward towards your body while I give you resistance. Is that okay? Too much? Any pain with that? Okay, just do 5 of those. Next one we're going to do is grab each end there. You're going to do is a row, go straight back. Just straight out, bend your elbows. Good job. Let's do 5 of those. How does that feel? Okay.
Hi, Daddy. Hi, Mama. Hi, Baba.
Good. Doing all right so far?
Yeah, didn't hurt that bad on that one.
That's good. That's generally one of the better ones for people. Okay, now we're going to have a little fun. See how well you're good at, since we got everything limbered up, see how good your reaching is with your left. You're allowed to bend. See if you can get it. Any pain with these at all?
A little reaching over like that.
Okay. I know you said you had a little trouble with like overhead stuff, like with your brushing your hair, teeth, or anything like that. So what we're going to try to do is, with your lovely hat here, with your left hand, have the bill of the hat to put on. That way you can use the other hand, the good hand, to put it back. But you can have that function of trying to put that on. That way you can get your arm up higher. Just do that a few times. Any difficulty with that?
Not bad. Didn't have to reach that far.
We'll see if you can, how difficult it is switching it and trying to put the back on with your left.
That one stretches it more.
More difficult.
Yeah. You can still get up there.
By hard getting it down over the hair.
Yeah.
So hard did you get it?
Okay, well that's all the exercises I have for you. I'm going to go over some home exercise stuff for you. That way you can do at home.
Okay.
The one is the levator scapula stretch, the one I did here with pushing down your shoulder and your head. You can do that yourself, standing or seated. Just look down towards your right elbow or your right shoulder and grab with the right shoulder and pull. And you'll be able to feel it through here pulling. So you can try that and see how that one is.
Look down this one.
Towards your right side, because that's your good side. Your left side's the one that's sore. And reach over top. No, reach over with this one towards the back of your head and pull it down like you're looking towards your elbow. Don't kill yourself.
I'm hurt a little more.
Okay. We're gonna do that 10 to 15 reps, 2 times a day. All these exercises you're gonna do 10 to 15 reps, 2 times a day. Next one is a pec stretch, which there's no real good place to do it. This is a little, just use a standard door. This one's a little wider than the standard door. But you can do 3 of them. I mean, only as high as your hand can go. You just kind of step into it and stretch. And then come to the center, stretch, and then down low, and stretch. All 3 ways. See how that feels for you. Feel okay? And again, 10 to 15 times, twice a day. Next one, I'll just explain it a little bit since you're taller than me, so I know you're within the limits of your shoulder extension. Just simple stuff like with a cabinet. Just kind of reach up, grab a can out. Just do that like 10 to 15 times. Like I said, I know you're taller than me. I mean, that would be more than your limit, but you being taller. The next one you could do is like when you're doing dishes or whatever, for putting them in the dishwasher or taking them out of the dishwasher into the cabinet. It's all the same, just use your left arm to do that motion. And where you're getting a good exercise, good stretching. The last one I want you to do is I'm going to give you a TheraBand to take home. Same thing as what we did here. Just like at a dining room table or something. Wrap it around there where you're seated. You do your rows this way. Or if you're holding it with this hand, make sure to put a towel underneath. You can do your internal rotation that way. I'll give you that to take home. I'm going to go ahead and check your blood pressure one more time since we did some exercises. Make sure you're okay with all that. Which appears you are. Running right at 120/80, which is very good. Your pills are doing what you're supposed to be doing. Do you have any questions, concerns?
No, nothing.
Okay, like I said, do that home exercise program. I'll give you a sheet to take with you so you know exactly how to perform them and what to do. Do 10 to 15 reps 2 times a day. Just do them once in the morning, once in the evening, preferably when you first get up and right before you go to bed. And your treatment is 3 times a week right now for 2 weeks. So it's Monday, so we'll see you on Wednesday, probably Wednesday and Friday. I'm not sure if you're scheduled yet. You can stop in the front desk and check with them. Anything else?
Nothing.
All right, well, it was a pressure. Thanks, Mason. We'll see you next time.